Welcome, ladies and gentlemen, to Chiropractic Today. We have a very special program today concerning something very close to my heart, and that's children. And as the opening of our show stated, we're talking about multiple handicapped children, a very unique segment of our society that we believe in chiropractically that they deserve some very special attention. As my guests today, I have two people who believe the same way and have dedicated a major part of their lives, professionally and otherwise, to the care of the multiple handicapped children. My first guest, Dr. Henry Rubinstein. Henry, welcome to the show.
Thank you. Nice
Dr. Henry is the member of the Board of Directors of the Florida Chiropractic Society, and Miss Gloria Jeffrey. Welcome to the show, Gloria.
Thank you.
Gloria is an RN, now in her 24th year of service as a registered nurse, and she is the administrator of a home here in South Florida.
That's correct.
We're going to talk a little bit about that. Gloria, you are an administrator of a home for multiple handicapped children. That seems like an awful lot of extra problems other than just a home for children. How did you manage to get into this extensive a program?
Well, first of all, I was a nurse in pediatrics for many years. And then my interest started coming this way, to wanting to take care of sick children.
How did you manage to get into the home business, where you have your own home now, where you take care of these children?
Well, I had a commitment to myself when I went to nursing school, when I was in my doing my psychiatric care, and I saw the suffering of humanity and how great the need to help people was. And I decided at that time I wanted to help people. So after I came to Florida, the need presented itself, and I made myself available to take care of these children.
This is not a 9-to-5 job, Gloria.
I know that. It's 24 hours a day.
7 days a week. I understand it. Dr. Rubinstein, what caused you to have the interest in taking care of these children with very special needs?
Well, I discovered that in order to let the world know the benefits of chiropractic care, the best way to begin would be to work on a population that there really wasn't much hope for or much advance in medicine. A population that if you could show a benefit, then the world could see the true benefits of chiropractic care, and especially the very young children, you could dispel the beliefs of placebo effect or the touching effect, where we can show here's a child that maybe has no idea that you even exist, and that can show benefit from chiropractic care and improve immunologically, physically, etc.
How did Dr. Henry end up coming to your home, Gloria, to work with the children?
There was someone who recommended Dr. Henry. And I, being a nurse, I said, no way, not a chiropractor coming here.
Do you mean your past education influenced your decision?
That's correct. That's correct.
I understand.
And I said, no, I don't want a chiropractor coming here. I have a pediatrician, and I feel that's enough. Well, she insisted, and she said, please, let Dr. Henry come. And because of her insistence was why I said, okay, just to get her away from it, I said, okay, we'll try Dr. Henry. And Dr. Henry came, and the result has been so astounding.
Well, let me ask you this, Gloria. You mentioned a little bit to me when we were off the air that you used to make an awful lot of trips to the emergency room with these extremely handicapped children. Tell our audience a little bit about that.
Well, you must understand, I take care of the medically and mentally handicapped and physically handicapped child. And we were back and forth to the emergency room. As a matter of fact, the nurses there, when I would show up, they would say, boy, you need a bed here.
You were there that often?
Yes, I was there that often. And the quality of life for the children was poor. They were suffering. They were taking medicines. And after Dr. Henry saw them, there was such an improvement. Our visits to the emergency room lessened and lessened, and now they haven't seen us for quite a while.
Quite a while. Now, before we go on further, because I want to go in deep with you and with Dr. Henry on some of the problems and the changes and miraculous type things that have taken place at your home, I'd like to take our audience, if you will, because we went to the home and we watched Dr. Henry, and I've got to tell you this. Dr. Henry is known by the children at the home as the Bone Ranger. I'm telling you that because you know the chiropractic affiliation with the spine and the bones of the spine, but that's his nickname by the children. And I noticed when we went to the kids were running up to get their adjustment. Dr. Henry, we're going to show the videotape of that at the time when we were there. And if you will just tell us what's going on right now as you go through. And Gloria, just jump right in here now.
Yes.
Okay.
This is where we keep our youngest children, and they're usually the sickest, and they're being adjusted right now. And children came to us, not walking, 4 years old, not walking, not talking.
Dr. Henry, you're using a handheld instrument. It's called an activator in chiropractic.
Activator.
Could you explain that a little bit, what you're doing?
Well, when I first started coming in there, I did manual adjustments only, and I found it a little more efficient and a little quicker to be able to use this percussion instrument so that I could palpate, find where the subluxation is, where the bone was out of alignment, and quickly administer the adjustment with the least amount of force, the least amount of attention on their part. So I could quickly get in and out without them really feeling anything or being upset.
There's that little click we hear is the adjustment being given.
That's it. That's a slight thrust that moves that bone over with that click.
And what you're doing there, I noticed that you're primarily working in the upper cervical spine area. Can you tell our audience why that is?
Correct. Well, basically, at the base of the skull, the atlas area, the first bone in the neck, and it's called atlas because it holds up the skull, that's the most important area of the spine. That's the gate, basically, of all life from the brain to the rest of the body. If that particular area is affected, then nothing really below that area is going to improve. So we primarily concern ourselves with the most important area. I call it the main circuit breaker to the body's health.
I see what you're saying. I noticed that as you're adjusting these very small children, there's no discomfort involved with this adjustment.
No, most of the time they don't even wake up.
Is that right?
And very, very rarely will anyone cry from an adjustment. In fact, usually they cry when I walk away.
Now, Gloria, these children are pretty seriously handicapped, some of these kids we're looking at. What are some of the conditions that the children are, at the home have been diagnosed with?
Cerebral palsy, seizure disorder, many
I remember when I was there,
that,
Gloria, you've got a young child there that has brain stem only. There actually is no brain tissue in the skull.
Correct. That's correct.
How severe can we get?
Yes, and many of them are blind. Some are blind and deaf, and they cannot walk. They are handicapped.
Severely handicapped.
Severely handicapped.
Dr. Henry, I notice you walk down the halls and you go into the rooms, you turn the lights on, you make the adjustments, and you look like you're part of the furniture there.
Well, they've become accustomed to me coming in and walking through now. And
here you go. There he is. You stop right there. Get my adjustment. Boom. Boom. That little tap right there. Now that little tap takes the pressure off the cervical spinal cord.
correct.
And then, of course, we improve the function. Now here we see children actually in wheelchairs receiving their adjustment. It was definitely, I had a chance to spend the afternoon there, and I noticed an extremely happy environment. The children were well taken care of, a very clean environment, a very caring environment. Gloria, you've got some assistants that help you there, I know.
Oh, yes, we have help around the clock, 24 hours a day.
You have to continue that process. Well, thank you very much. That was right there at the home in South Florida. Now, what I'd like to discuss with you here, Gloria, you mentioned that within a short period of time of Dr. Henry coming to the home and giving these very specific but very simple non-traumatic spinal adjustments, you noticed a change in the number of visits to the emergency room. How long before you noticed that change?
I would say it was approximately 5 to 6 weeks.
Within 5 to 6 weeks, you saw this change. These children are so severely handicapped that a crisis situation must have been part of your regular experience.
Oh, regular. Yes, we were always running to the emergency room. the change was so dramatic that we said, oh, wait a minute, we haven't been to the emergency room in such a long time, and we started looking at children who were having crises all the time, sickle cell, anemia, and we find that he was becoming sicker less. And
So
we
you
just
saw
the
an actual
dramatic
change,
yes, the dramatic change.
Even in a condition as well known as sickle cell anemia, you saw that
Yes.
this child seemed to be less symptomatic.
Yes, less symptomatic.
Dr. Henry, what do you think about it? I mean, you know, you're in an area that chiropractic is not usually accepted. I mean, chiropractors usually, by the public in general, talk about cricks, backaches, and strains. And of course, we're trying to tell them on our show that that's not the case. And here you're doing it with severely handicapped children. What's the story with it, with sickle cell anemia? And
Well, to me, it's quite simple. If there's interference within the body, interference to the main control of all function, to every single aspect of the body, if there's interference there, that person cannot express themselves at 100% and reach their full potential. My purpose in going there is not to cure these children. My purpose in going there is not to make them walk, not to make them see, not to make them hear, not to do anything symptomatic, but to give them the best chance in life that they could possibly have, something that no one else has offered them ever, and that's the ability to function from within at their best. Now, will that guarantee they never need medical care or never need medicines or surgery? Absolutely not. But regardless of anything else, they deserve and have a right to function at 100%. And that's my goal in life, to see that those that need it the most get it.
Now, Gloria, when we were at the home, you mentioned a case in particular to me that I thought was quite dramatic. I believe you had a young girl, baby girl, who had been diagnosed with spinal meningitis.
It's a baby boy.
Baby boy, okay. What happened in that case?
The pediatrician called and said, Gloria, I want you to know you can expect to hear that little R has expired.
Didn't expect him to live.
No, because he coded this morning, you know, his heart stopped in...
Coded means his heart stopped.
His heart stopped.
How old was he at this time?
He was about 8 months old.
8 months of
yeah.
age, okay.
So I said, all right. I told Dr. Henry about it. He said, oh, Gloria, you should have told me about it before. Dr. Henry immediately went to the hospital and adjusted him. And he showed sign of improvement almost immediately.
By signs of improvement, what do you mean?
Improvement, he kind of wasn't as comatose as he has been.
So he was comatose?
Yes, he was comatose.
The heart had stopped?
The heart had stopped.
The pediatrician said, don't expect for us to bring him home.
Yes.
That he was going to expire. You're going to lose this 8-month baby boy. And Dr. Henry went down and adjusted him?
Yes.
Similar to what we saw on the television?
Yes.
And within a matter of days?
Yes. And within 2 days, he was less comatose and was responding to treatment.
How long before he came home?
Well, he was in the hospital for quite a while because they couldn't find a suitable home for him.
Oh, I see.
But he's still alive.
How long ago was that, Gloria?
This was about...
It's almost a year.
A year ago.
Been a year, and this was a baby that wasn't supposed to live.
That's right.
A matter of days, and a year's gone by.
That's right.
And we're talking meningitis. Now, that's a pretty infectious, dangerous, deeply concerning disease process. Dr. Henry, you had no problems with going in and adjusting this baby, although this condition had been diagnosed?
Not at all. Not at all. In fact, you have to understand, this child is not your ordinary infant. This child was born with multiple handicaps. His intestines were born outside his body, multiply afflicted. So we're not even talking your standard, everyday, normal infant that acquires meningitis. This was a very ill and afflicted child that developed meningitis. And to me, he needs that adjustment. Even if that adjustment means to let him go, he needs that adjustment. And as a matter of fact, the moment I started giving him that adjustment, he started to cough, he started to wake up. And as a matter of fact, he was out of intensive care the next day.
Is that right?
He was in the intensive care in a private room with a private nurse under a tent. And I walked in, and fortunately, the nurse was very understanding and removed the tent and held the oxygen to him as I adjusted him.
So you could make the adjustment.
And it was quite simple. It took 1 minute, and I walked out.
You know, Dr. Henry, I think what we're saying here is what this shows is that when you remove any kind of blockage in the central nervous system, the inherent innate ability of the body to mend, to heal, to get well, to live, its will to live, is greatly enhanced. And that's basically what happened, because you didn't give any special adjustment for meningitis.
Nothing.
It's not the treatment of meningitis.
Not
it's
at
the
all.
alleviation of the nerve pressure.
Just to give that child its best chance.
Gloria, have you had other cases of this nature in the home?
We had one little boy who came in. He was 4 years old, and he was not walking, he was not talking. And after about 6 weeks, he started walking around the crib, holding on and walking. We put him out of the crib so that he can walk around, and now he's in public school.
He's in public school?
Yeah, and we can't keep him quiet. He runs around, he talks.
Is that right?
Yes, yes.
And you noticed these changes again following the adjustment?
Oh, yes. Oh, yes. I had one little boy, when he came, they told me, now, just put him where you can see him because we think he's going to go soon. And he's
these kids come to you critical.
Oh, critically ill. Very ill. And he's doing very well. He'll be graduating from pre-kindergarten this month.
These kids
he'll be going to graduation. And that's right. And he'll be graduating, will be going to Dade County Public School in the fall.
Dr. Henry, how do you feel about that?
Everyday stuff to me.
Everyday stuff to me. I know you make a tremendous effort on behalf of these children. Dr.
I
Henry,
expect, well, truthfully, I expect no less from the body.
let me ask you this now, and I know Gloria's obviously seen some cases. Are there any cases that you personally have taken care of in there that impressed you? I mean, like you say, it's every day for you, but that's still pretty neat to see these kids get well. What cases do you have that you remember?
Well, they're all great. I go in there with the understanding that as soon as I make the adjustment, I expect everything to go away.
I hear you.
I expect a miracle every time. So truthfully, it doesn't surprise me or shock me when there is a great result. There's one girl in particular that, because it was more of a mental affliction, that surprised me, because I understand the body functioning better and improving and everything, you know, improving that way. But mental, to me, I still have a little block. I have a mental block with mental problems.
That's above the neck, I hear.
So, but this particular girl, I believe she was 7 years old. 7 years old, and she was autistic, I would say. That was what was her problem, one of her problems. And she would basically just stand in one place and go around in a little circle and sing all day long.
That's right.
And after a few adjustments, after a while, I was getting reports that she was getting up, carrying on conversations, asking, making requests, and I believe she's going to school now.
Yeah, she's reading.
And if I ever need to know the date, I ask her, what's today, and she tells me June. And
yeah.
How long did she go in this circle?
Oh, she was for several months. She was in that circle. She was always repeating what she would say, and just singing. Now she goes to school, she reads from a book.
Carries on conversations?
She carries on conversations, yeah.
Communicates?
She communicates very
receives
well.
communication?
Yeah, she
initiates communication
yes.
and going to school?
Yes.
How long a period of time?
Well, I would say it took about 10 months.
10 months to see this kind of
yes.
a change?
Yes.
That's a short period of time.
Everyone's quite impressed.
That's amazing. Gloria, this had to impact cost of health care.
We were running to the emergency room, you can imagine, for gas and for paying staff to work overtime. It was really
tremendous impact on the cost of running the home.
Plus, not using the Medicaid card as often.
So the state Medicaid paid for all the health care?
Of course.
Well, I mean, what are we talking about on a per-day basis or an emergency room visit?
On emergency room, you have to pay approximately $150 for the use of the room.
Just
and
the room?
Seeing the doctor, x-rays, they're all charged separately.
And then on a per-day basis with the child in the home?
I would say sometimes we're there 4 times a week, 5 times a week.
And if the children had to stay overnight or stay?
Of course. And it would be more.
So we're literally talking within a week, we're talking thousands of dollars.
That's correct.
Now those thousands of dollars were paid for by the state Medicaid program?
By the state Medicaid program.
The state Medicaid program is not paying that money anymore?
No, no. Now we usually go to the pediatrician, and it's for immunizations, if they have a cold, and or something like that, but they're not
very often.
Not very often.
So literally thousands and thousands of dollars are being saved by the fact that you're not at the emergency room 4 or 5 times a week.
That's correct.
And let me ask you this. Does the state Medicaid program notice the reduction in health care costs at your facility?
I don't know if they do. I really don't.
Do they ever ask?
No, they never ask. But usually we have to ask the pediatrician to fill out forms for us, to give us the update. And he visits, the pediatrician visits every other week or as the need arises. If we need him, we call him.
I gotcha.
But no, we're not using the Medicaid card that
So the
much.
overall general health of the children in your home has done what?
Very well. I mean, it is like night and day situation. The quality of life has improved. The children smiles, they laugh, they try to sing.
They were doing all that when I was there.
Yes.
Laughing and singing and dancing and running around.
And they run around. They're very happy.
Now, Gloria,
Very happy.
you stated earlier in the show that when someone suggested that Dr. Henry Rubinstein come to your facility, you said, no way.
That's correct.
What's your attitude now, Gloria?
Well, I get chiropractic care myself.
You've been
Twice
converted,
a week,
have you?
yes, twice a week.
Have you noticed any improvement in your own health?
Oh, yes. I noticed at first when I was receiving the care, initially, I would be very sleepy afterwards. I was so relaxed that I could just sit and fall asleep. Now I have several people who religiously come for their adjustment.
That's it. You got
Yes.
staff under care.
Yes.
The children are under care.
Yes.
Gloria's under care.
That's right.
The health and happiness of the home has improved.
Yes.
Gloria, what would you say to other people who are involved in care for handicapped children or severely handicapped children? Would it be of benefit for them to seek the help of a chiropractor in the general well-being health care of the facility?
Yes, I believe that. They would have to try it. Everyone is always skeptical of the chiropractor. But they should just try it. Just, let's say, try it for 2 months, 3 months, and see what happens.
See the difference.
See the difference. There's a big difference. I am convinced.
I'm glad to hear that. Dr. Henry, what would we say to chiropractors that are out there in the field? Should they be seeking communication with the shelters and the homes in their area and try and help the kids?
Well, they should be doing pretty much what my patient and the person that did with Gloria, and that's never take no for an answer. That the welfare of the children, the welfare of the world, chiropractic in general, depends on them not taking no for an answer. Eventually, you'll wear them down, they'll say yes, you'll get in, and they'll never regret allowing you in. So the big thing is never take no for an answer. You have a service, chiropractic is a service they need, whether they realize it now or not, and you need to give it to them. So my advice to all the chiropractors is, if you hear of such a home, or if you hear of a place like that, go out and offer your services, and by that we can teach the general population the benefits of chiropractic, and then the entire world benefits by having people off of drugs, being happier, feeling better, laughing and playing.
That's super. I'd like to thank my guests, Gloria Jeffrey, administrator,
Yes.
24 years, a registered nurse, and taken on a big job, and Dr. Henry Rubinstein, chiropractor, friend of mine and a member of the board of directors of the Florida Chiropractic Society. Thank you both for spending some time with us here today.
Thank you for having us.
Thank you.
Ladies and gentlemen, you're here sharing with us today. These folks are here voluntarily and sharing a story with you that's benefiting severely handicapped children here in South Florida, and we hope through this message will impact other homes throughout Florida and throughout our nation. We think it's important chiropractically that children are raised to the best of our ability in a drug-free environment. Chiropractic represents that environment. It's a healthcare principle based on the fact that health comes from within the body and that the body is a self-healing, self-regulating organism designed to service you healthfully as long as you live. Thank you much for being with us today. Join us next week on Chiropractic Today.